My name's Dr. Thomas Richardson. I'm a clinical psychologist and I've been researching for several years the link between financial difficulties such as debt and mental health problems, and I've been a senior advisor for TellJO for about 4 years. Well, there's just such a strong relationship between mental health problems and debt arrears. We know that people who are in problem debt are more than 3 times as likely to have a mental health problem. And it can just be a vicious cycle where you're struggling to pay the bills, that impacts your mood, you're depressed, you're anxious, and then if you're depressed and anxious, it's just really hard to try and get on top of that, and you might avoid opening letters and not take a look at your bank balance, and so the situation worsens. So it really can be like a vicious cycle. Unfortunately, we have services which are generally set up, you go here for financial support and you go here for mental health support. Never the twain shall meet, but actually the way I see it is they're so overlapping as to be the same problem. So if we want to try and help people, what we need to do is try and tackle both of them together, which is exactly what TellJO tries to do. If people are left unsupported or they go to enforcement, potentially things are just going to get a lot worse, because we know from research that the worse your financial situation is, or if there's legal problems that come with it, your mental health is going to deteriorate as well. So it is just going to create a vicious cycle. People are going to feel more hopeless and potentially kind of suicidal as well. And also when people are in that space, they can just avoid and bury their heads in the sand even more because it feels too much. TellJO supports people experiencing poor mental health in a number of different ways. First of all, we ask questions to identify mental health problems, but we also use evidence-based scientific questionnaires which will screen for depression and anxiety, because actually a lot of people who are depressed or anxious don't know about it, let alone are they getting help. So that's the first thing we do, is we do try and identify mental health problems, what people might be struggling with. And then the second thing is this automatic signposting to a range of different supports, which people can access both in terms of finances, but also in terms of kind of emotional mental health support as well. And that automatic signposting is just much more of a convenient nudge, doing it all in one rather than just being given a flyer which people won't read. If you actually get something that is personalised and sent to you and said, we think this service is going to be helping for you, it's just going to get a much better buy-in than something that's just very generic, one size fits all. What I love most about TellJO is just how quick and simple and easy it is. If you're really depressed, if you're really anxious, it just feels so overwhelming to even pick up the phone and ring the council or ring the GP. People will avoid it. The great thing about TellJO is it's just in a few minutes, it will ask all the questions that are needed, and it's online. You don't have to pick up the phone. You can speak to someone if you want to, but you don't have to do the initial assessment, which is just so much easier to give someone that nudge to actually reach out, and it asks the right questions. And I think the beautiful thing is that then it automatically will signpost people to support. So it's just exactly what someone who is struggling with mental health needs. It's simple, it's quick, it's effective.